should be out there within the next week to 2 weeks. So we will have this recorded session. But I'm going to go ahead and turn it over now to Justin to get started with our presentation, and we appreciate you taking time out of your busy day to join us. Justin. For some reason, Justin, if you're speaking, I'm not able to hear you. Give me just a second to see. I'm looking to find you, Justin, because he's saying that he's muted, but hold on one second. Okay, try now.
All right, can you hear me?
Yes, sorry about that.
All right, no problem. Thank you, Valerie. Thank you, everyone, for attending today. Once again, my name is Justin Ruchis. I'm the Attest Easy Consulting Manager here at DrFirst. I really appreciate you guys taking the time out of your busy schedules to participate in the webinar. As I go through, if you have any questions, feel free to type those in the question box, and we will answer those at the end of the webinar. Today we'll be going over Attest Easy, the Meaningful Use Consulting in strategic partnership with Management Plus. We'll also be going over a meaningful use overview, kind of what is the landscape, penalties, and other of those sorts. So today's agenda is going to be meaningful use, an overview of the program, the meaningful use attestation process, the meaningful use audit, the practices dilemma, and then what is Attest Easy Consulting. So what is meaningful use? What is an overview? So there's two programs that you can participate under meaningful use, either Medicare or Medicaid. For Medicare, the process is defined by the Center for Medicare and Medicaid Services, better known as CMS. Meaningful use occurs in year 1 and beyond of using your EHR. From the time you start meaningful use under the Medicare program, you're collecting structured data. If you're beginning meaningful use in 2014, you can capitalize on $24,000 over 3 years, $12,000 eligible this year. If you started last year, you were eligible for $39,000 in overall incentives. If you're attesting under Medicaid, the process defined by your state Medicaid agency, although you're still collecting the same menu and core objectives as you would if you were attesting to Medicare. It occurs in year 2 and beyond of using your EHR. The first year of the Medicaid Meaningful Use Program is called AIU, Adopt, Implement, Upgrade, and you're registering for the program providing proof of purchase. They don't deem that as a structured data meaningful use reporting period. Maximum incentive for Medicaid is over 6 years, and it's $63,750. Capitalizing on $21,250 for that first year participation. So who's eligible for meaningful use? Any eligible professional can participate in the Medicare or Medicaid program. You can only participate in one, so you can't do Medicare and Medicaid. But if you've attested in the past and you want to switch from either Medicare to Medicaid or vice versa, you have to do that by the end of the year. After 2014, moving into 2015, you have to stay with the program you selected. You can only switch once. So if you did Medicaid last year and you want to do Medicare, you can do that, but after 2015, you have to continue on with that program. For Medicare, optometrists and ophthalmologists are eligible. For Medicaid, ophthalmologists are eligible. Keep this in mind because there is some talk out there that optometrists can qualify for Medicaid incentives. That varies state to state, but it's not recognized from CMS at the federal level yet. So yes, there are some states that accept it, but majority do not. Then you must meet the minimum Medicaid or Medicare thresholds. For Medicaid, a non-pediatrician is 30% Medicaid population as defined by a 90-day snapshot from a year past of a 30% Medicaid population, both primary and secondary. If you're a pediatrician, you can see 20% Medicaid population, but you'll also receive a reduced incentive payment. For Medicare, it's $16,000 in annual allowables this year, calculated on the 2014 calendar year, to receive the full $12,000 in incentives. If you see below $16,000, you'll receive 75% of what you do see. So there's still money, even if you don't hit that minimum threshold, to participate in meaningful use, along with avoiding the penalty that is going to begin in 2015. So what are some important dates for Medicare? We focus on Medicare program because Medicaid, there are no payment adjustments on your Medicaid payments. But for Medicare, you could see up to a 5% penalty for not attesting. If you're a first-year tester, you must attest successfully no later than October 1st to avoid the 1% and 2% penalty. You'll also qualify for the incentives. If you miss the October 1st, you can still attest by the end of the year to qualify for incentives and avoid the 2%. You will definitely see that 1% starting 2015. If you do nothing in 2014 and begin in 2015, you'll just be attesting to avoid penalties, but you will not be able to qualify for incentives. If you've attested in the past, you will be able, so if you attested in 2011, 2012, or 2013, you will attest at any point during the calendar quarter in 2014 to avoid the 2% penalty in 2016. It's a delayed penalty, so it does not onset. There are 2 calendar quarter start dates remaining. July 1st just began, and then you have October 1st. So if you've already tested in the past, you have 2 start dates. If you are first year, you can start for any 90-day period. So what is the meaningful use attestation process? First, you demonstrate. You understand the CMS requirements and submission process. You ensure your practice is adhering to the appropriate meaningful use stage core and menu objectives. So now within systems, you can see either stage 1 or stage 2 data. If you're stage 1, you must adhere to the 14 core, 5 menu, then go through the attestation process. If you're stage 2, it's 17 core, 3 menu that you have to adhere to. When you go to a test, you configure and input clinical data into CMS reports, submit compliant core and menu objectives to CMS and state Medicaid agencies, submit CQM measures to CMS, and complete a risk analysis. A risk analysis is an assessment of the security within the office to protect PHI and EPHI. This is the #1 reason for a failed audit. So what are some things to know about attestation? First, the adopt, implement, upgrade process for your state. If you're going for Medicaid, there's differences from state to state. It's not a uniform process. Texas, for example, is a postal mail registration process. It takes upwards of 60 days to be approved. Your state's process for submitting an immunization record. This does not qualify for a majority of you since it is optometry, ophthalmology, but it's also nice to know how you'll file that exclusion in case the state requires a questionnaire like Michigan or another process. How to select your menu objectives. If you've attested previously, you know that you could have filed an exclusion and that would count towards your objectives. Starting in 2014, you must attest to any objectives that you collect structured data on. So meaning you can't file an exclusion until you've exhausted all structured data menu objectives. We will go over that with you, what you should be filing and how a roadmap workflow could make sense to your office. What clinical quality measures your EHR is certified for. This is a big one. You have to attest to clinical quality measures that your EHR is certified to attest on. Also, what to do if there's a 0 numerator denominator for a clinical quality measure. You can still attest to that number. What to do if your meaningful use report says you are failing a measure. You will have a meaningful use report that you can view, but if you're failing a measure, where do you turn to? Is it a false sense of security, or do you know how to pick up your meaningful use compliance or teach the staff how to meet that within the system based on objective comprehension? Then changes in 2014 for both Stage 1 and the introduction of Stage 2. If you've attested in the past for Stage 1, there's changes that have come for 2014 that you need to be aware of, and then Stage 2 begins as well. So what is the meaningful use audit? First, there's two. There's either prepayment or post-payment audit. We know that 10% of all attestations will be selected for an audit. They already stated 20% of all 2013 attestations will be selected for an audit. Audits target suspicious or inconsistent data. If it's a unique denominator, unique patient count, they need to match. Selected providers must submit documentation to validate attestation. If you're attesting to 3 or more exclusions, it will likely your chances of triggering an audit. We know this. We prepare you for that. You only have 2 weeks to provide documentation when selected for an audit. A post-payment audit can occur up to 6 years after the reporting period. So if there's turnover, documents lost, where do you turn to collect those documents so you don't have to pay back that incentive? And then you must pass 100% of the audit measures or all incentive payments must be forfeited. They will recoup. If you fail, you can go through the appeal. Sometimes it just delays the recouping of the incentive payment, but what we're finding is if you've failed an audit in the past, you are almost certain to receive another audit for your subsequent year reporting period. We're going through with providers right now that just failed an audit and they're already being audited for the next reporting year. So what are the small practices dilemma? First, small practices have fewer staff and resources to devote to meaningful use. They simply don't have enough time to give another hat to the office manager who's already handling HR, front office, and day-to-day operations of the practice. Independent physicians struggle to keep up with revolving meaningful use rules. Meaningful use changes. Since the introduction in 2011, 2012, 2013, and now 2014 have seen changes to how you report your meaningful use data. Meaningful use is causing some independent physicians to leave practice. They're either taking hospital buyouts or they're not going to see Medicare or Medicaid, which is forcing them into an early retirement. Meaningful use audits are confusing and time intensive. If you don't have the proper documentation or know where to turn, you could miss that 2-week deadline. It's initiated through email, and if the correct email is not on file at time of registration or updated, you might never receive that notice. So where does the strategic partnership between Management Plus and the Attest Easy consulting service make sense to you? Well, the Attest Easy service can include 6 key components. First, it's meaningful use education. We focus on the core and menu objectives that we're going to be collecting structured data on, and then teach you how to understand what it takes to meet those in the system, and education so that you can relay that to staff members, but you have a stronger understanding of what needs to happen and why they're requesting certain pieces of information. Workflow optimization. We focus on those objectives that need data collected, and we don't focus on those that are exclusions. So we put together a roadmap specialized to the needs of your practice so that you can achieve meaningful use and it makes sense without a major overhaul. It's attestation assistance. We offer from registration to attestation everything in between and what could come after. So we can help you register if this is your first year. We can make sure the data is up to date. In case you are audited, you receive that letter. But then we do live monitored touch points through GoToMeeting, and we do that weekly to review your meaningful use dashboard and work on different objectives to make sure that you are compliant on all measures. We help you complete the risk analysis as well. Remember, #1 reason for a failed audit, we see it time and time again, this must be filed in the office. So what we do is we take you through an ONC approved risk assessment, and we help you complete that, providing justification for any gaps or the lack thereof gaps if you guys are 100% compliant based on the assessment. It's audit support and archiving. We already have developed templates through the help of Figliozzi, who is the Medicare auditing contractor. We also work to get you the certification and screenshots needed to satisfy an audit. We've gone through multiple audits. We know what it's going to take to make sure that you keep that hard-earned incentive money. And then it's stage 2 guidance. Whether you're starting stage 2 this year or you're moving to stage 2 next year, we're going to provide you the guidance and education so that you feel comfortable making that transition from stage 1 to stage 2, and you can achieve compliance early. If you're stage 1 this year, once we get you compliant on the core and menu objectives in stage 1, we work to get you up to compliance thresholds for those same objectives for stage 2, so it's an easy transition come 2015. So what makes us different? First, it's a tailored to your situation approach. We understand how your office works, and then we train you with a workflow that makes sense to your individual needs based on practice size and involvement of the staff. It's the power of one. You're going to work with the same consultant during every scheduled monitoring session, and if you ever have questions in between the scheduled sessions, you can call and get an answer. We encourage that because we really want to be your meaningful use expert and liaison through the process. It's an extension of your practice. Think of us as a remote employee brought on to help you through meaningful use. No longer do you have to worry about compliance and the changing landscape of meaningful use, nor do you have to go and hire an outside position or employee for that reporting period. You bring us in, we go over meaningful use, we help you achieve meaningful use, and we're there through the audit process if selected. Inclusive pricing. We understand that you want to stretch your dollar as far as it will go. So there's no cap on consulting hours, whether it takes 15 hours or 25 hours or additional calls during the reporting period. There's no additional charge for audit support, and there's no additional charge for the risk analysis. The price you pay at the beginning of the reporting period is what you pay throughout the reporting period, no additional hidden costs. Proven success. We've been helping providers go through meaningful use and the attestation process since 2011. We have helped capitalize on over $11 million for our providers we've worked with for meaningful use incentive payments. I really want to thank you for attending today. I'm now going to open it up for any questions you might have. But if you have any additional questions, you can reach us directly at 866-263-6511, extension 3012. Again, if you have any questions, type those in the question box.
I'm just waiting. So far, there's no questions. Oh, hold on. One question that's just come up is the cost.
Excellent question. So the cost is per provider during the reporting period. It's $1,495 from start to finish. That includes audit support and risk analysis. But we definitely will tailor that. If you have a larger practice, we can work with you. The best thing would be to reach out. We can give you a pricing quote that makes sense to your office. Another question that came in is, we began July 1st, but we're really not comfortable with our compliance or understanding meaningful use. Can you still help us? Yes, this is a common question. We can definitely help you to understand the meaningful use objectives and get your compliance up to speed so that you can attest to avoid those penalties and capitalize on the incentive payments. So we definitely encourage you to reach out to us so that we can help you understand the compliance, but there's still time to help you meet and achieve meaningful use this quarter. Question is, how much time to set up? Once we reach an agreement with the office, we can get going within 24 hours, so it's a very quick process from getting going and then getting the consultant assigned to your account so that you can get compliant and we can start those monitoring calls immediately. We are starting meaningful use stage 2, and we want it to begin October 1st. Can you help us prepare for that reporting period? Yes, we are working with multiple providers right now that are starting October 1st, but utilizing us to become understand the stage 2 requirements and really feel comfortable so that we can begin and we can help with that compliance monitoring come October 1st. What we do is we take the time right now to go over the different objectives, what's changed, and how we're going to implement that workflow. Do you contract to only provide the risk assessment? Yes, that is something that we have done in the past, so we can definitely discuss that with you. If you feel that the risk analysis is the piece that you need help with, we can definitely work with you on that to help you complete that. What is the ONC approved risk assessment you use? So what we use is a document produced by the ONC at the beginning of meaningful use that basically covers any gaps that there could be in EPHI and PHI. ONC stands for the Office of National Coordinator. So we definitely make sure that you understand what's being asked, how to justify the gaps, and if there are no gaps, how to justify what questions were asked and how to continue on to make sure that there are no gaps in the system. Do you guarantee that a client can attest in the last quarter? So with anything, there is no guarantee in meaningful use. What I can say is that if you follow the roadmap, work with the consultant, there is no reason that compliance cannot be met and you will not be able to achieve meaningful use. The reason I say there's no guarantee is because you'll be working with our consultant, but we'll also be working with your office. So with the providers we've had, we've never had a provider fail that's worked with the service and implemented the changes or listened to the advice we give. Great questions, guys. I'm going to wait a couple last minutes for any additional questions. We attested in 2012 but did nothing in 2013. Can we still attest in 2014? And what reporting period would we be in? If you attested in 2012 and you were Medicare and did nothing in 2013, you will be starting stage 2 this year, but you'll also see the onset of a 1% penalty in 2015 for doing nothing in 2013. You also lost the incentive available for the 2013 reporting period, so you'd be attesting for $8,000 this year. If you were Medicaid and you attested and did the AIU in 2012, nothing in 2013, there's no penalty or loss of incentives. You'd pick up stage 1, year 1 in 2014. Is there an email address for contact too? Yes. You can email me at jrouches@drfirst.com. What changes have come to 2014? One of the biggest one is the introduction of the patient portal is a requirement now, so we help integrate that into your workflow, which will make sense moving into stage 2 as well. We have one physician attesting for stage 1 full year and one physician attesting for stage 2 beginning October 1st. Can you help with this? Yes. We definitely can help with both stage 1 and stage 2. There is no full year this year, so if they're in stage 1, year 2, they will just be attesting to a calendar quarter. So we could either start October 1st for both providers, or we could do July 1st for the stage 1 provider and October 1st for the stage 2. We can work for what would be best for your office, but we can definitely help being that both are on different stages. Our physician is very busy with patients throughout the day. Do you have to work with just the physician? No. We actually usually work with a point of contact in the office. That's usually the office manager or an MA, and we found that to be very successful so that the doctor doesn't have to take away from patients. And then we will set up the recurring touch points throughout the week on a time that makes sense for the point of contact. And if the doctor would like to be involved during these calls, we will also go ahead and find a time that works best for the doctor and the staff members. All right, guys, if there's no additional questions, I want to thank you all for taking the time out of your day. Once again, you can reach us at 866-263-6511, extension 3012, or my email is jrouches@drfirst.com. Thank you again.
Thank you all for attending. We appreciate you joining our webinar. Thanks, Justin. Bye-bye.